As a case manager, I work alongside 2 other case managers for Brookings Health System. Our goal is from the moment a patient comes into the hospital, we are their resource, their way of being able to get them the needs that they have or that they need before they are needing to go home, essentially. So as case managers, we establish a relationship with the patient in order to get them medical equipment. Maybe they need home health care when they leave. Perhaps they're not safe to be home any longer and they need a higher level of care. As case managers, we step in and we establish a relationship with the patient and we figure out what works best for the patient by working with them as well and their family members.
Case managers assess patient needs, evaluate and create treatment plans, and coordinate care, all while working closely with the patient and the healthcare team.
What we have to remember, and sometimes we have to step back and remind ourselves, a patient coming into the hospital, it's a difficult task. It's very cumbersome, it's very overwhelming. They are very scared. And if a patient perhaps came into the hospital because they fell at home and now they're looking at a 4 to 6 week rehab recovery, they're not always prepared for what is in store. And it's not them necessarily getting back home right away. So it's very important that on day 1 or day 2 we establish a relationship with them to kind of get that process started, to get that in their heads that, okay, this is a stepping stone. We're going to get you through this, but we need to do this first before you can actually get home. Some are receptive, others are not, but at the end of the day, it's what's best for the patient. And sometimes they don't always like that, but they understand it at the same time. So it's communication and collaboration, and without those 2 things, it doesn't work as well. So we do the best job that we can to collaborate and communicate with them. And it's also a collaboration with the entire team that the patient works with here in the hospital.
Not only do case managers provide treatment options and cost-effective solutions, they work with the patient's health insurance company and help with discharge planning if the patient has continuing medical needs after they leave the hospital.
The best and most rewarding thing is those success stories, really. Being able to have a patient come in and to know that we can make a difference and that we can help them transition. And sometimes it's difficult transitions, but we can help them, idle them along to a better outcome, essentially. It's in gaining their trust. When you first meet somebody, there's a lot of uncertainty. And so as you work through a process with them and they learn to trust you and their family members, and then you are able to provide an outcome for them that they are actually happy with, that's very rewarding.